Namaste Bitya, Hamisha Khush Raho Bitya. A very good morning to you all. Myself, JV'n Dr. Ravi Jain, Assistant Professor, Department of Practice of Medicine, and Faculty of Homeopathic Science, JAYOTI VIDYAPEETH-FHS University, Jaipur. In today's lecture, we are going to discuss about the common unexplained symptoms of psychiatric cases. Whenever a patient of psychiatric disease is coming to you, then how can you examine the common unexplained symptoms in that particular patient? We are going to understand that particular thing today in this lecture. Some physical symptoms cannot be explained when one does not find a definitive physical disease as a cause. So, some physical symptoms cannot be explained. Whenever a patient is coming to you with a lot of symptoms, there are some physical symptoms which cannot be explained when one does not find a definitive physical disease as a cause. One labels them as medically unexplained symptoms. These are commonest and often most frustrating to the primary care physician. So, the symptoms which cannot be explained by the physician are most frustrating for the primary care physicians to explain them. The patient with these symptoms must be subjected to various investigations before labeling them as the psychiatric symptoms. So before labeling them as psychiatric symptoms, you have to label them. You have to do certain tests or perform certain tests or investigations by which you can label them as psychiatric symptoms. In some patients, the physical or psychiatric illness may coexist, or there may be a direct causal relationship between the two. So there can be a direct relationship between the physical and the psychiatric illness in the patient. Sometimes the physical and psychiatric illness are unrelated. In some cases, you will find that the physical and psychiatric illness are not related to the patient. That is, a schizophrenic patient with a brain tumor. These cannot be related together. Schizophrenia is different, brain tumor is different. But the complaints are present in the patient altogether. Each patient relation to illness may be influenced by their emotional state and will affect the course of disease. Both of these things will affect the emotional state and the course of disease. Detailed history and psychiatric examination are essential in these cases. So you have to take the detailed history and you have to do the psychiatric examination. That is very much essential. Now, there are some common unexplained symptoms without the underlying organic cause that we are going to discuss in this particular table. The symptoms like headache or dizziness. This is a vague symptom and it will be referred in the neurology. The symptoms like vomiting, irritable bowel function, dyspepsia, these will be referred to the gastroenterology. Symptoms like dyspnea, hyperventilation, these are related to the respiratory system and will be referred to the pulmonology. But you will not find any cause, any underlying cause under the particular disease condition. Atypical chest pain or palpitations due to any without any particular cause can be referred to cardiology. Tinnitus will be referred to rhinolaryngology. Low back ache will be referred to the orthopedic physician. Pelvic back pain, pelvic pain, premenstrual tension, vaginal discharge will be referred to the obs and gynae. Chronic fatigue will be referred to the internal medicine, and fibromyalgia will be referred to the rheumatology. So these are the various symptoms which are present in the case of a psychiatric disease. But when referred to the particular specialty, we cannot find any causative uh, cause or underlying pathology. And these, after performing various investigations, will be labeled as psychiatric illness. So the common unexplained symptom without underlying organic cause. So this was all about today's lecture. In the next lecture, we are going to discuss about common symptoms of depression, disease disorders in the pictorial form. This was all for today. This session is powered by Digital Virtual 2.0 JAYOTI VIDYAPEETH-FHS University. I hope you are satisfied with my digital session. If you have any query, please mention in the comment box and I'll try to resolve it. So this was all for today. Thank you very much. We will be meeting in the next lecture.